Assalamualaikum and good day everyone. I am Nasser Mudalay. The first reporter I'm going to discuss about of enteral nutrition. What is enteral nutrition? Enteral nutrition, also known as tubing feeding, is a way of delivering nutrition directly to your stomach or your small intestine. For example, like like ng ICU, yung pasyente na may stroke or mild stroke yon. Tapos, doon mo siya i-tube feeding. For example, yung mga liquid feeding, like mga milk, liquid, yon. Yun ang ibig sabihin ng enteral nutrition. I-tube mo yung pasyente, dito ka mag-start dito sa ilong, papasok dun sa internal organ, papunta dito sa esophagus, hanggang dito sa sikmura ng pasyente. Tapos dun, para hindi mahirapan yung pasyente, dun sa daanan ng esophagus, madaanan ng mga pagkain, yan ang para madali yung pagkain niya. Okay, next one is parenteral nutrition. Is the feeding of nutritional products to person intravenously bypassing the usual process of eating and digestion. The products are made by pharmaceutical compounding companies. Okay, dito naman tayo sa parental nutrition. For example, ang meaning dito, yung mga pasyente na iti-take na yung mga medicine, for example, mga vitamins plus mineral, yung mga kahit anong mga kuha, basta resita ng doktor na insert dito sa mga veins. For example, yung mga IV fluid, yan, at saka dito sa mga IV titig, dito sa mga veins, at saka dito sa mga parte ng katawan or dito sa internal organs, dito sa mga abdomen, at saka dito sa mga dito sa stomach or gastro. Okay, yung mga dapat yung mga gamot na mga for example, yung mga brand na mga medicine or medication na resita ng galing sa doktor, iti-take yung pasyente na mga for example, yung gamot na galing sa kumpanya, for example, yung Unilab company, yan.
Assalamualaikum and good morning. I am Dipatuan Ejamaludin, our group 9. My topic for today is all about the tube feeding, standard tube feeding. What is tube feeding? Tube feeding is a way of getting your body the nutrition it needs. Tube feed is a liquid form of, kumbaga ang tube feeding na ito yung daan para sa ating mga katawan at pumasok din dito yung mga nutritions. There are three types of feeding tube. First one is NGT tube, and NGT tube, and percutaneous endoscope. Next one is the tube standard feeding. What is a standard tube feeding? Standard tube feeding, ito yung mga formula, kumbaga ito yung mga formula na nag-design siya para siya sa mga bata or mga adult. Kumbaga halimbawa, pwede makagamit yung mga normal, kumbaga mga normal na standard na mga formulation, like include dito yung mga nutrients required dito para ma-maintain ang ating body, ang ating kalusugan. Some of standard formula can be used. Kumbaga minsan daw ang standard nito ay nagagamit natin para benepisya sa ating enteral feedings as long as ito ay nagiging isang oral supplement.
Good morning and evening everyone. My name is Amera Hajib Basit. So So, ang minimin dito na daily food plan ay para sa mga pasyente na mayroong problema sa kanilang gastrointestinal. So, una, ano ba ang kanilang pang araw-araw na pagkain o nakaplanadong pagkain? For example, coffee, 2 cups of the milk powder. Hindi yan may papainom agad-agad siya ng problema sa gastrointestinal ng pasyente kung hindi siya maging juice only lang na parang ma-absorb sa kanilang tiyan. Kumbaga, sa egg, hindi dapat agad-agad din yan may papainom sa pasyente kung hindi siya ma-strain or soft cooked na parang absorb sa kanyang gastrointestinal. Tulad din sa sugar. Hindi din yan papainom sa pasyente kung hindi muna matunaw yung sugar. Tsaka dapat may halong sucrose or glucose or lactose or corn syrup. And that's all. Thank you.
Good day and Assalamualaikum. I am Yasin Siti Byronisa. So my assigned topic is all about blenderized tube feeding. So what is blenderized tube feeding? So blenderized, it consists of soft diet allowances which can be blenderized easily. So ayun, so much better na diretso na lang tayo sa formula and solving para mas lalong maintindihan ang paano mag-solve sa blenderized tube feeding. So ito yung formula sa blenderized tube feeding. So ayan, so formula given na to yung volume equal calories and then over calories and then the density. So ayan po yung given. So given na talaga yung calories are na 1,800 kilocalories and then yung calories density naman natin is given na talaga yan 1 calories per milliliter. So ito na yung solving niya. So ayan, nakikita natin. So ito yung gagamitin natin na formula. Given na talaga siya. Ayan. So ayun. So volume equal 1,800 kilocal dahil ang nakalagay sa formula natin is yung sa taas yung calories and din sa baba yung density natin. So ang nakalagay sa calories natin sa taas is 1,800 kilocalories and then sa baba is 1 calories per milliliter. So madali lang yan. I-divide lang natin and then na-divide is the result is 1,800 milliliter dahil natanggal yung kilocalories natin kasi ayan, magkapareho sila. So natanggal na siya. So ang natira lang is yung milliliter niya. That's all.
Assalamualaikum, I'm Ismail Najma and my topic is all about complications. So let's proceed the complications. The first complication is mechanical. Then the complication of mechanical is nasopharyngeal irritations. Nasopharyngeal irritations is ito yung most condition na affecting sa ating lalamunan. Swollen adenoids, namamaga ito and madalas nangangati. Then the most common condition affecting sa ating nasopharynx is yung pag-uubo, cough, and then itchy or watery eyes or mild fatigue or tiredness, then runny nose or stuffy nose and sore throat. Namamaga ang throat natin. Then ice chips may help to prevent mouth sores. Then topical anesthetic are used to relieve pain and itching caused by conditions. Then decongestant are type of medicine that can provide short-term relief for a block of stuffy nose. Then sa luminal obstruction naman, flask replace tube. Then when you say luminal is abdominal. Then direct luminal obstruction is referred to be the primary and principal cause of acute appendicitis. Acute appendicitis is sudden and severe inflammation of the appendix. Then third is mucosal erosions. Mucosal erosions is erosive gastritis. When you say erosive gastritis is gastric mucosal erosions. Then erosive gastritis is an inflammation of the stomach. Then minsan yung tao na merong gastric erosion is nakaka-experience siya ng severe bleeding, matinding pagdudurugo or vomiting, and a black bowel. Then sa tube displacement. Tube displacement na ginansot tubuwa in insertion through the nose, then esophagus, and down into stomach. Kinansot patients katataguan sa tubo para roo pag-inject so pagkaniyan. Then if so patients na accident yan mapulso tube, actually tawag sa tube na yun is nasointestinal tube or NG. And mag-causing ito ng displacement. Then, pag na-displace sa tube na, typically, complaints of abdominal pain that worsens during his feeding. Then, lastly is aspiration. Aspiration is discontinued tube feeding. Aspiration is an infection of the lungs caused by inhaling saliva, food, liquid, vomit, and even small foreign object. Kaya cause ang mga yan kasi when you inhale food, stomach acid or saliva into your lungs, you can also aspirate food that travels back up or galing sa stomach mo at sa esophagus mo. Then all of that things may also carry a bacteria that can affect your lungs. Then, if left untreated, complication can be serious. And that's all.
Good day, I am Faida Sultan Adapan. Today I'm going to discuss about complication of gastrointestinal. So what will happen when we have a complication in our gastrointestinal? When we say gastrointestinal, it is the tract or passageway of our digestive system. Kapag ang nagka-problema yung ating gastrointestinal ay ang magkakaproblema yung daluyan ng ating pagkain. So kapag ang mga complication ng gastrointestinal is ang una ay ang pagkakaroon ng cramping. When we say cramping, is ito yung pamamaga sa ating katawan. So, may mga formula na kailangan gawin sa formula o gamot para maiwasan natin ang pagkakaroon ng cramping. So, we should need to use infusion rate. So, pangalawa naman ay ang pagkakaroon ng diarrhea or vomiting. When we say vomiting is yung pagsusuka at diarrhea is yung pagtatae. So may mga kailangan daw natin ng formula para maiwasan natin or magamot ang pagkakaroon ng diarrhea o vomiting. Kasi nga, gastrointestinal is sa loob ng ating digestive system, sa loob ng ating stomach. So ang nagkakaroon ng problema yung mga glands na nasa loob, yung mga small intestine, esophagus, large intestine na kung saan sila yung para matunaw yung mga pagkain na kinakain natin. So, yun na nga, kapag nagkaroon ka ng diarrhea at vomiting, so kailangan mo gamutin ito through anti-diarrhea. So, ang pangatlo naman ay ang constipation. When we say constipation is, constipation is kasalungat lang to ng diarrhea. Yung hindi ka na nakakaramdam ng pagdudumi. So, kapag hindi ka daw nakakaramdam ng pagdudumi is, ang mangyayari sa atin ay sasakit yung tiyan natin at minsan pwede magka-epekto sa loob ng ating gastrointestinal. So, yun na nga, ano ang kailangan natin gawin kapag hindi tayo nakakaramdam ng pagdudumi or hindi tayo nakakaramdam ng pagdudumi. So, kailangan daw natin ng sufficient fluids or fibers sa ating katawan para naman lumabas yung hindi maganda sa ating katawan, yung yung mga hindi magagandang nakain natin sa ating katawan na nagiging dahilan ng ating pagkakaroon ng complication ng gastrointestinal. So also kailangan mong i-encourage yung pasyente na kumain siya ng encourage yung pasyente na magkaroon siya ng exercise or activity para matunaw yung kanyang kinakain o makaramdam siya ng pagod at yun ang maging sanhi ng pagdumi ng pagkaramdam niya ng pagdudumi.
Assalamualaikum. Hi everyone, I'm Siti Naida Aryong Kadir. Metabolic is the process your body uses to get or make energy from the food you eat. Food is made up of proteins, carbohydrates, and fats. Hypertonic dehydration increase free water. Glucose intolerance reduce infusion rate, give insulin. Cardiac failure reduce sodium content, fluid restriction. Renal failure decrease phosphate, magnesium, potassium, protein restriction, essential amino acid solution. Hepatic encephalopathy, decreased amount of protein. The process of making and breaking down glucose molecules are both examples of metabolic pathways. A metabolic pathway is a series of connected chemical reactions that feed one another. The pathway takes in one or more starting molecules and through a series of intermediates converts them into products. Diabetes is the most common metabolic disease.
Assalamualaikum and good day everyone. My name is Asmin Rahman and I'll be discussing the advantages and disadvantages of feeding roots. So I'll be discussing the characteristics, advantages, and disadvantages of nasogastric tube. So what is nasogastric tube? From the word naso or means nose, para madali nyo itong matandaan. Yung nasogastric tubes, it is a tube extends from nose into the stomach. So yung nasogastric tube ay una itong dumadaan sa ating ilong, papasok sa loob ng ating katawan, dumadaan muna ito sa esophagus, papunta sa ating stomach. Okay, now so let's proceed to the advantages of using nasogastric tube. So nasogastric tube, the advantages of this is it is a rapid placement requiring minimal equipment. Feedings can be immediately following. So ang paggamit po ng nasogastric tube ay hindi po ito masyadong nagre-require or nakakagamit ng maraming equipments. That is the advantages. And confirmation of tube placement and vowel sounds, formula can be delivered or continuous sound. So yung sound na minimin doon ay yun yung maaring maging signs na na-deliver na yung foods or nutrients sa loob ng ating stomach or katawan. So, if there is an advantages of using nasogastric tube, there is also an disadvantages of using the nasogastric tube. So, a tube can be easily removed by the patient. So, isa po yun sa mga disadvantages, yung madali pong matanggal yung tube sa ating ilong. So, dapat po ay kapag linigay po ito ay lalagyan po ito ng plaster or any kinds of thing that will be easily removed para po ma-maintain yung tube sa ating ilong. So, tube can be inadvertently inserted into trachea, especially among patients with poor gag reflex. So, one of the disadvantages of using nasogastric tube ay maaari din yung tube ay doon mapunta sa trachea, which is yung trachea, yan yung responsible na dinadaanan yung hangin sa loob ng ating katawan. So, dapat po ay maiwasan po yan. Dapat ay doon po madaan yung tube sa ating esophagus. So, and anomalies in nose and neck, and also the deviated septum, esophageal strictures, may prevent tube placement. So, ang ibig sabihin ng esophageal strictures is an abnormal tightening of the esophagus, or esophageal strictures can limit or block food and liquid that's traveling from the throat to the stomach. So, yung merong mga esophageal strictures, maaari din yan yung maging dahilan para hindi maganda yung pagkapasok ng tube placement sa ating loob ng katawan. So, dapat ay before po gagawin yung procedure ay alamin muna yung mga maaring maging tendency or maging problema sa procedure na gagawin mo. So you're here now in the procedure of how to insert a nasogastric tube. So the first you're going to do is prepare the equipment like the NG tube and the other things that will be possibly needed in the procedure, and also perform hand hygiene. It is important to avoid contamination and verify the patient identity and explain to the client what you are going to do, how does procedure, kung paano ba gawin yung procedure, kasi kailangan po yung cooperation ng patient para ma-prepare po niya yung sarili niya before the procedure. So, kailangan po ng ma-explain mo ito sa kanya ng mabuti para po madali itong matapos. So, before you're going to start is, first you're going to measure the NG tube of, you start from the tip of the nose, and then yung tip of the nose at saka yung air lab po. So, and then the xiphoid sternum. So, after mo ma-measure na, like for example is na-measure mo is 5 cm, is pwede mo siyang lagyan ng mark doon sa NG tube para madali yung procedure. So, if you want to know more detail about the insertion of NG tube, please watch this video.
To prepare my patient for a nasogastric tube insertion, I've gone ahead and elevated the head of the bed. I'm going to cover their chest with a towel. I could also give them a basin or an emesis basin and maybe even some tissues, because this can stimulate their gag reflex and they might need to gag or potentially even vomit. So I want to make sure we're prepared for those scenarios. So before I start the procedure, I like to get some tape prepared, because there will be points in this procedure in which I need tape and I only have one hand available. So I'm going to do a couple pieces of tape to make sure that they are prepared for use. You can see I've got lubricant, I've got my nasogastric tube, I have pH strips, a container, and a piston syringe. So I'm going to open their NG tube. And my first step is to measure it. So I need to measure where on this tube I should probably insert or stop the insertion, right? So I'm going to start at the tip of their nose. I'm going to go to their earlobe, and from their earlobe, I'm going to go to their xiphoid process, or that tip of their sternum. So I can estimate that at about 50 is where the end of this tube should be. So I should insert it about that point. So I'm going to mark that with some tape, but you could do this with a marker if you wanted to. Once I note that, I'm going to lubricate the tube to facilitate the insertion. So I'm going to open my lubricant, and I'm going to insert the tube and generously apply some lubrication. Once I'm ready, I'll go ahead and ask my patient to flex their neck up a little bit. I'm going to insert it into the nair. If I meet extreme resistance, I need to stop, withdraw, and either try again or try the other nair. I don't want to push past extreme resistance. So I'm going to go ahead and insert it. And to help facilitate it into the instead of going into the esophagus, I can encourage them to swallow, swallow, swallow. If they're oriented and capable, I can give them a glass of water and they can take small sips during this time. And I'll tell them to swallow, swallow, swallow. And you can see I've made it to my tape. So I've made it to what I've estimated is the correct length. And I'm going to go ahead and secure this to their cheek. If I don't secure it, it could slip back out and then we would have to start all over again. So while it's secured, I want to double check that this is in their stomach. And the best way to do that is to use my piston syringe, withdraw some of the gastric secretions. So I'm going to just withdraw on that. Gastric secretions would come out. I would drop them into my cup. I would take one of my pH sticks. I would dip it in, and the pH stick would indicate what number this is. It needs to be less than 5 for me to feel comfortable that it's in the correct spot. Now, I will also note that an X-ray is the gold standard. So especially if I'm going to use this NG tube to insert anything, medication, tube feeding, we need to do an X-ray to make sure that we're actually in the stomach and not in something else like their lung. So after I check the pH and I'm fairly comfortable, but then especially after I do the X-ray and I'm confident that we are in the correct placement, I can not only anchor this more securely, but I can attach it to suction. Anchoring it more securely simply means anchoring it to their nose. There are devices that allow you to do this, but everywhere has tape, so I can split halfway down and put the solid portion on their nose and wrap the remaining portion with the part I did halfway. So this is called the split tape method. It's not super friendly on mannequins. There we go. I'll remove that one, and I can remove that one. So that's a little more secure. I could then attach something to their gown so that this doesn't pull from here to here, so I can secure that to their gown as well. This portion should always be above their stomach, and then this is how I connect it to suction. So if ordered, I would simply plug this in to my suction tubing, which is connected to my suction canister. My suction canister is connected to the vacuum of the suction on the wall. And I would turn that on. I can use this dial to determine what suction they need to be on, and I can set it for consistent or intermittent suctioning. Once ordered for it to be removed, my first step is to turn off the suction, disconnect it from suctioning, and then depending on the facility, it's optional to retest placement. So some facilities want you to flush the tube before you withdraw it. And if I need to flush the tube, I need to check placement first. So I would use that piston syringe, check the pH again, and then I would flush the NG tube with 30 milliliters of water or air. Once I flushed it, I would remove the tape or securement device from their nose. I would again make sure they have a towel, a tissue, because once this comes out, a lot of times mucus comes with it and they may want to blow their nose and there might be a lot of mucus collected there. I'm going to say, all right, on the count of 3, I want you to hold your breath while I pull this out. I'm going to pull it gently but steadily. All right, 1, 2, 3. And we're done. And like I said, this is often covered in mucus. So I like to just cover everything up with my glove. They're often coughing and blowing their nose at this point. I discard this and give them anything they need to clean up. And that's how I insert, connect to suction, and take out a nasogastric tube.
Good morning and Assalamu alaikum. I'm Amal Musnifa and I'm the reporter of nasojudinal or nasojejunal. The characteristic of nasojudinal is nasojudinal tube extend from nose through the pylorus into the duodenum. May be advanced by peristalsis or video chloroscopy. Nasojejunal tube extend from nose through pylorus into the duodenum and is usually placed by video chloroscopy. Ang nasojudinal ay ito ay isang tubo na nilalagay sa ating ilong through the stomach at ito ay mag-e-end sa duodenum. At ito rin ay kadalasang nilalagay sa pamamagitan ng video chloroscopy, which is ang nasojudinal tube is ito yung ginagamit sa mga pasyente na nahihirapan kumain. The advantage of nasojudinal rest for aspiration may be reduced. Feedings are better tolerated by patients with poor tolerance to gastric feedings, gastric retention, or reflux. Nasojejunal feedings permit enteral feedings in patients with partial gastric outlet obstruction or duodenal fistula. Napababa nito ang paghirap na paghinga ng pasyente at pagpapakain ng pasyente ay mas napapadali lalo na sa pasyente na may gastric retention, ulcer na karamdaman. Ang nasojejunal feeding ay tumutulong ito sa pasyente na may postural gastric or duodenal fistula na karamdaman. Ang disadvantage naman ng nasojejunal is dislodgement of tube into the stomach by coughing or vomiting is common, will increase risk of aspiration in patients with altered gastric motility. Administration usually limit to continuous delivery of formula. Small intestine does not tolerate bolus feeding or sudden rate changes well. May require use of pump. Ang paglalagay ng tube sa may tiyan na parte ay maaring maging sanhi ng ubo or pagsusuka ng pasyente. Posibilidad na pagtaas ng paghirap na paghinga ng pasyente na may gastric or ulcer na karamdaman. Ang administration ng hospital or doktor ay pinapahintulutan nila ang patuloy-tuloy na pag-deliver ng pagkain formula sa pasyente. Ang small intestine naman ay di kanyang ititolerate ang bolus feeding or malalaking amount na pagkain or maaring ang pagbigla-bigla ng rate ng pagkain ng pasyente. Recommended ng doktor ang paggamit ng pump sa pasyente. That's all and thank you.
Assalamualaikum warahmatullahi ta'ala wabarakatuh. I am Norania Minor, PSN 2. So, ang aking report ngayon is about the enteral and parental nutrition. So, feeding route, the esophagostomy. Esophagostomy is a muscular tube connecting the root with the stomach. The esophagus is about 8 inches long and is aligned by the most. So meaning, ang esophagus ay isang muscular tube na nagdudugtong sa lalamunan o lalamunan natin sa lalamunan sa tiyan. So ang esophagus ay humihigit kumulang ng 8 inches ang haba at may linyang basa-basa.
And the advantage of esophagostomy. Procedure can be performed under the local anesthesia. Ang pamamaraan ay maaaring isagawa sa ilalim ng
lokal na anesthesia. At ito ay hindi nangangailangan ng pagbubukas ng abdominal wall. At ang pagpapakain ay maaari nang simulan kaagad.
Ang disadvantage naman niya is routine that requires surgery and formation of a stoma which must be carefully maintained. Skin the surrounding stoma may become irritated, hood may become affected. Excessive the granulation of tissue surrounding stoma may occur. The accidentally diagnosement of tube is the common. Require the immediate replacement of tube to prevent the closure of stoma. Gastric incontinence may leak around the tube with the gastrostomy. Hooded the dehiscence may occur. GI bleeding and aspiration. Gastrostomy feeding usually cannot be started until up to 72 hours after surgery. PE placement is often too difficult or impossible in severe obstetrics. So meaning, ang disadvantage daw ng esophagus, ito ay nagmula sa nangangailangan ng operasyon at pagbuo ng isang stoma na dapat mapanatili o maaaring mairita ang balat na nakapalibot sa stoma, o ito ay maaaring mahawa ang sugat o maaaring mangyari ang labis na granulation ng tissues na nakapalibot sa stoma. Ang aksidenteng pagtanggal ng tubo ay karaniwan o ito ay nangangailangan ng agarang pagpapalit ng tubo upang maiwasan ang pagsara ng stoma. At ito ang mga nilalaman ng tiyan ay maaaring tumagas sa paligid ng tubo na may gastrostomy, o ito din ay maaaring mangyari ang dehiscence ng sugat o pagdurugo at aspirasyon ng GI gas. So, yun lang po yung report ko, and thank you.
Good evening everyone, my name is Normala Alimakadato. So for today, I will be talking about the gastrostomy or percutaneous endoscopic gastrostomy, or also known as PEG. Pig feeding tube insertion is the placement of feeding tube through the skin and the stomach wall. It goes directly into the stomach. Pig feeding tube insertion is done in part using procedure called endoscopy. Kinakailangan ito para sa mga pasyente na nahihirapan kumain o uminom. And then next is the characteristic. Tube is passed through incision in abdominal wall into the stomach. Pig tube is percutaneous placed in the stomach under endoscopy guidance, secured by rubber bumpers or inflated balloon catheter. So this is the example. The example on how endoscopy goes directly into our stomach. Yan yung halimbawa niya. Then next is the advantages. It takes advantages of the stomach natural function of adjusting osmolarity, mixing and serving as a reservoir, ensures provide nutrients are allow maximal opportunity for absorption, closed stimulates natural delivery of nutrients into the stomach, eliminate nasal or esophageal irritation, esophageal sphincter, close may reduce risk of aspiration tube, unobstructive. Pig placement can be performed under local anesthesia, less expensive, and pig feeding can be started after approximately for 24 hours. So that's all.
So let us proceed to duodenostomy or percutaneous endoscopic duodenostomy or PEJ. So here are the characteristic, advantage, and disadvantage. So here are the characteristics. Types of duodenums, needle cutter placement, direct tube placement, and the creations of jejunostoma that is characterized intermittently PEJ. Weighted feeding tube passes endoscopically through a strostomy tube from PEG insertion into the duodenum. Peristaltic actions advances tube into the jejunum. Kasama sa mga uri ang paglalagay ng needle catheter, direktang paglagay ng tube at intermating or PEJ, weighted feeding tube na ipinapasa sa endoscopically bilang trostomy tube mula PEG insertion papunta sa duodenum. Ang pagkilos ng peristaltic ay umuusad sa tubo ng jejunum. Advantage: permit feeding in a patient with an upper GI tract obstruction, esophageal reflex, ulcerative or neoplastic disease of stomach, impaired gastric emptying, reduced rest for aspirations, early postpartum feeding, possible jejunum rapidly resume its function 12 to 24 hours. Pinapahintulutan ang pagkain ng pasyente na may upper GI tract obstruction, esophageal reflux, ulcerative o neoplastic na sakit sa tiyan na may kapansanan sa gastric emptying na binabawasan ng panganib para sa aspirations, ang post-partum feeding, possible jejunum rapidly resume its function within 12 to 24 hours. So let us proceed to the advantage. Surgical procedure is required ambulatory. Patient may find jejunal feeding restrictive because of the need for continuous infusions of formula. Sa pamamaraan ay required ang mga pasyente sa ambulatory ay maaaring makakita ng jejunum feeding na mahigpit dahil sa pangangailangan para sa patuloy ng pagbuhos ng formula.
Hi, I'm Pambayan Najima, PSN2, and this is my report. Vitamins and minerals. Vitamins fall into two categories: fat-soluble and water-soluble. The first one is the fat-soluble vitamins. A, D, E, and K dissolve in fat and are stored in your body. The water-soluble vitamins, C and the B complex vitamins, such as vitamins B6, B12, niacin, riboflavin, and folate. Dissolved in water, your body can store these vitamins. Any B or C vitamins that your body does not use travels through the bloodstream and lost mostly when you pee. So you need a fresh supply of these vitamins every day. Vitamins. Vitamins are organic substances, which means they are made by plants or animals. Minerals are inorganic elements that come from soil and water and are absorbed by plants or eaten by animals. Your body needs a larger amount of minerals, such as calcium, to grow and stay healthy. Mineral. Water is the foundation of all life. The surface of the earth is 70% water, and human beings are mostly water, ranging from about 75% of body mass in infants, 50 to 60% in adults, and as low as 45% in old age. The percent of body water change with development because the proportion of muscle, fat, bone, and other tissues change from infancy to adulthood. Of all the nutrients, water is the most critical, as its absence proves lethal within a few days. importance of water in the human body can be loosely categorized into 4 basic functions: transportation, vehicle, medium for chemical reactions, lubricant, shock absorber, and temperature regulator. Maintaining the right level of water in your body is crucial to survival, as either too little or too much will result in less than optimal functioning. Several minerals are key to regulating water balance in different compartments of the body. The most important of these are sodium, potassium, and chloride.
Good day, my name is Shaik Asliya, reporting the last part of our report. So we have the root. Root is a way to get from one place to another place. So we have the number 1, the peripheral vein root. This root is intended for patients with mild to moderate nutritional deficiency. We have A, short-term maintenance and not hypermetabolic, or NPO, for 2 weeks. Letter B, supplemental energy and protein to an oral diet. C, weaning into enteral or parental hyperalimentation requiring additional energy and protein. So, para mas madaling maintindihan, ang peripheral vein root ay isang maliit or maikling plastic catheter na nilalagay sa balat patungo sa ugat ng isang pasyente. Kadalasan sa kamay, siko at sa inyong paa. At itong peripheral vein root is ginagamit ito upang mabigyan ng fluids at medication sa mga pasyenteng may mild to moderate na kulang sa nutrition. So we have the number 2, the parental hyperalimentation. This is a long-term nutritional support of 2 weeks for patient who cannot be fed through the GIT. So ito ay isang pangmatagalang nutritional support ng na hanggang 2 weeks na para sa mga pasyenteng hindi nagagamit ang kanilang GIT. So ang GIT is the gastrointestinal tract. Ito'y isang parte ng ating digestive system na dinadaanan ng pagkain. So, in an easy way to understand, the parental hyperalimentation is a form of nutrition that is delivered into a vein. Para sa mga pasyente na hindi maka-absorb ng nutrients gamit ang kanilang digestive system, kasi nag-cause ito ng vomiting or severe diarrhea. So, that's all.